Comparative Healthcare Japan vs. the United States. Number 1334, August 25, 2025. Gerald C. EclaireMD Foundation. Category: Healthcare System. When we compare healthcare systems around the world, few contrasts are as striking as those between Japan and the United States. Both nations are wealthy, technologically advanced, and committed to medical innovation. Yet, their healthcare outcomes could not be more different. Accessibility. Japan has provided universal health coverage since 1973. Every citizen, from newborns to the elderly, is insured through either employer-based or community-based programs. Patients can choose their doctors freely, and outpatient services are widely available. On average, a Japanese person sees a physician 13 to 14 times a year, more than 4 times the US rate. CT and MRI machines are also more widely available, allowing for earlier diagnosis and treatment. Together with Japan's healthier diet and lifestyle, these factors have made Japan a world leader in both obesity rate and longevity. The US, however, has no universal coverage. Insurance is fragmented across employers, Medicare, Medicaid, and private markets. Millions remain uninsured or underinsured, leading to major access gaps. For those with coverage, care can be excellent, but for many, especially lower income and minority populations, access is uncertain and unequal. Cost. Japan spends about from 10 to 11% of its GDP on healthcare. The government sets a national fee schedule that fixes the price of medical services, drugs, and tests. Costs are adjusted every 2 years, and caps limit out-of-pocket expenses. Most citizens pay about 30% of the bill, while seniors pay less, and maximum ceilings prevent personal financial ruin. The US, by contrast, spends 17–18% of GDP, the highest in the world. Prices for identical services can be 10 to 15 times higher than in Japan, not because of better technology, but due to administrative overhead and profit-driven pricing. Billing, insurance negotiations, and multi-payer complexity drive up costs. Medical debt is now one of the leading causes of bankruptcy in America. Outcomes. Japan consistently ranks higher in life expectancy, 85 years versus 78 in the US, lower infant mortality, and far lower obesity rates. Cancer survival rates are better, kidney dialysis outcomes are stronger, and heart transplant survival in Japan approaches 96%, far above the global average. By contrast, the US faces stagnating or even declining life expectancy, fueled by obesity, diabetes, cardiovascular disease, and substance use. Reflection. The US paradox is clear: higher spending, weaker results. Japan proves that universal coverage, price regulation, and preventive care lead to longer lives at lower cost. Yet Japan also faces challenges, especially with an aging population and low birth rates threatening system sustainability. Each country shows both strengths and weaknesses, but one lesson is unmistakable: equitable access and cost control matter as much as advanced technology. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be edited or republished as your own.